Well, according to the CDC, more than 38 million Americans have diabetes, and that is actually 1 in 10 people in the U.S. So 90 to 95% of those who have type 2 diabetes, which has become a major health crisis.
Yeah, and today, Melissa McGuire, Program Director of the Cardiometabolic Center Alliance, is here to share who's at risk to develop type 2 diabetes and the tools to help manage. Good morning, Melissa.
Good morning.
So to start, can you explain the two types of diabetes and why this is a glowing global health problem?
Yes, so type 1 diabetes only affects about a third or less of patients living with diabetes, and that really is the body's ability to make insulin stops. They think that this is related to potentially autoimmune. There's really nothing you can do to prevent type 1 diabetes. Type 2, on the other hand, does have some genetic risk factors, but also some lifestyle factors. And obesity in itself, which is also an epidemic, is a leading cause potentially for folks developing type 2 diabetes.
So who would you say has a higher risk of developing type 2 diabetes, and how does having type 2 diabetes actually impact the patient's health?
Those who have a family history, someone in their family has been living with type 2 diabetes, because there is a genetic component to this. So that definitely puts you at risk. If you're carrying excess weight around your midsection, you're a little bit of a higher risk. And certainly those that may be leading a sedentary lifestyle. And the reason that it's important to get a handle on type 2 diabetes is it can lead to some really long-term chronic health problems, particularly cardiovascular disease. We know there's a strong link between type 2 diabetes, cardiovascular disease, kidney disease, and even liver health.
Yeah, and it's something that we definitely want to manage. And now there are more tools than ever before to help monitor and manage type 2 diabetes. So what are some of these new tools available, and how can utilizing them actually help patients?
Yeah, it's really been just an explosion of new tools and medications over the last 10 or 15 years. One of the ones we've heard a lot about, a GLP-1 receptor agonist, and that's because it treats not only glucose and blood sugar, but also is really beneficial for weight loss, which we said there's a link, for protecting your heart, which there's also a link with type 2. But one of the other ones I think I'm most excited about are continuous glucose sensors. They're about the size of a quarter. They attach to your arm, and they give you the ability to know what your blood sugar is doing 24/7. You don't have to poke your finger anymore, and you can really make informed behavioral decisions. If I eat this, what happens? If I do my activity this way, what happens? Because you have those glucose numbers right in your hand, in your pocket, on your mobile device, or on a monitor, and can really take an active role in your care.
It's so great to have that information just readily available at your fingertips. Now, there is a continued focus on cardiometabolic disease. Why would you say this is so important? What are we learning?
I think, we're really starting to understand the interconnection between metabolic, which is diabetes and obesity, and the cardiac component, which is your heart, your liver, your brain, all of those issues, and how they play a role. And by treating one, hopefully you're treating all of them, and you're realizing that that interconnection is very important and really enables patients to have much better outcome when you look at them as one disease state and not separate diseases.
Yeah, and the St. Luke's Cardiometabolic Center has such a unique approach. What's the treatment model, and how do you help patients?
So we do have a center that we opened about 7 years ago, really putting that sort of in play, where it wasn't just treating folks for cardiovascular disease, but it was also realizing the connection of their diabetes, their obesity, all of those other things, and treating it holistically, looking at their conditions in a 360-degree view, and helping them come up with a plan that really helps them treat all aspects of that. And they're seeing much better outcomes when you look at it in that holistic view.
Well, very exciting stuff happening over there. Thank you so much, Melissa, for joining us this morning and for sharing all these great tips.
Thank you.
Hey, to learn more, head over to stlukeskc.org/cardiometabolic or give them a call at 816-751-8327.